In this section, our focus is toward a sound understanding of heartworm disease, how it develops, and steps that can be taken to prevent it or treat it if it should occur. This disease tends to follow very definite geographic boundaries. Areas of the country that have more mosquitoes tend to have a higher incidence of heartworm disease. This is due to the simple fact that mosquitoes are the vectors that transmit the disease from one dog to another. Let's begin with a basic understanding of what is heartworm disease. Basically, heartworm disease is an infection of a spaghetti-like worm called Dirofilaria immitis in the heart and lungs. Unlike intestinal worms, the Dirofilaria do not reside in the digestive tract or intestines, but rather they primarily live in the bloodstream, within the heart, and the major blood vessels of the lungs. Because of the high incidence of this disease in the southern and eastern states, and other areas with a high mosquito population, dogs are routinely placed on a monthly, semi-annual, or sometimes daily heartworm preventive. Because this disease is very common and often life-threatening if untreated, it's very important to be able to answer a variety of questions regarding heartworms and their prevention. What happens to a dog if he or she is bitten by an infected mosquito and is not on any preventive? The infective larval stage is spread to the dog during the mosquito's normal feeding process. These larvae migrate through various tissues of the body, and after 4 months they end up in the heart. Here the adult worms grow to nearly 14 inches in length. Just as other animal species have male and female genders, so too there are male and female heartworm. Within 2 months of arriving in the heart, the female worms reach sexual maturity and begin to reproduce. They reproduce and create baby heartworms called microfilaria. These microfilaria circulate in the bloodstream of the dog, and they must first pass through another mosquito before they can grow into new adults. Prior to the heartworm reproducing, it is very difficult to detect if a dog is harboring an infection. Thus, the first 6 months of an infection are very difficult to detect. The adult heartworms may begin to create symptoms after 6 months if there are sufficient numbers to obstruct blood flow to the heart and lungs. Common symptoms of heartworm disease include coughing, weight loss, and labored breathing. The disease may progress to spitting up blood and eventual death. How can someone prevent their dog from contracting this deadly disease? The key word here is prevention. Puppies are often started on a heartworm preventive as early as 4 weeks of age, depending on the product. There is a monthly, semi-annual, and daily preventive that is given as directed by the manufacturer. These preventives are very effective in preventing the adult worms from developing. These medications can be given during just the mosquito seasons, but are often given year-round in many parts of the country. The most common medications used to prevent this disease are ivermectin, which is the active ingredient found in HeartGuard, HeartGuard Plus, and Iverheart, milbemycin, which is found in the products Interceptor and Sentinel, selamectin, which is found in the topical preventive known as Revolution, moxidectin, which is the active ingredient in ProHeart 6, and finally DEC, a daily preventive often packaged as Filaribits. This latter form of preventive is now used less frequently when compared to the monthly and semi-annual preventives. ProHeart 6 is given as an injection every 6 months on dogs that are at least 6 months of age. The remaining products that were mentioned are used monthly. Each of these work very effectively at killing the migrating larvae before they get to the heart. Is ivermectin, found in HeartGuard and HeartGuard Plus, dangerous to collies and shelties? Collies and collie mixes have been shown to be more sensitive to ivermectin. The dosage of ivermectin found in the HeartGuard and Iverheart products, however, are low enough to be completely safe for any and all breeds. How is heartworm infestation detected? Any dog over 6 months ought to be tested prior to initiating a preventive. The primary way that heartworms are tested for is by one of 2 types of blood tests. One tests for microfilaria, and the other tests for antigen, or microscopic protein molecules shed by the adult worms. Both tests have their place in determining the heartworm status of a dog. The most sensitive test, or the one most likely not to miss a heartworm-positive dog, would be the antigen test. This sensitivity is important because we are discovering that not all heartworm infections produce microfilaria. These type of infections are called occult infections. Occult literally means secretive or hidden. The only way to diagnose these patients is to check their blood for antigen. The microfilaria test is often used to evaluate patients on a daily preventive, such as filaribits. It is also used as an inexpensive screening test on adult dogs that have never been on a preventive. If a dog does test positive, is it treatable? Most heartworm-positive dogs can be successfully cured if the infection is caught in time. The earlier an infection is diagnosed, usually the better the prognosis or outcome. What's involved in treating a dog for heartworms? The patient is initially evaluated to be sure that the organ systems can handle the treatment. This is important because the first phase of the treatment involves introducing a poison into the body that will kill the adult worms without significantly harming the patient. The most commonly used drug to treat heartworm infections is called imidacide. This arsenic compound has the advantage that it is administered by injection into the deep muscles over the back, as opposed to intravenously. Only 2 injections are required 24 hours apart with this treatment regimen. Once the adult worms have been killed, the body begins the process of slowly digesting the dead worms in the bloodstream. As with any major medical procedure or treatment, there are inherent risks. Heartworm treatment is no exception. Though mild complications do occur, there are not a lot of fatalities with the treatment. To keep things in perspective, remember that the risk of not treating is tremendously greater than the risk of treating. Can the preventative be given without prior testing? Remember, dogs less than 6 months old do not need a blood test. All others should be tested. Dogs that are to be started on filaribits every day should definitely have a test done for microfilaria prior to initiating the preventive. These drugs will instantly wipe out microfilaria if present and may cause a severe allergic reaction due to the showering of dead microfilaria into the bloodstream. Most veterinarians also recommend retesting every year. Annual retesting may not be a necessity in every dog, but many veterinarians strongly recommend it, because over the course of a year, it is not uncommon that the appropriate dosing interval is missed or variations in weight may have occurred. Are there any other benefits to keeping my dog on heartworm preventive? Many of the preventive products used today effectively help to prevent intestinal parasites such as roundworms, hookworms, and whipworms, and some have a combining agent to control fleas, ticks, and even mites. Some examples of these heartworm preventives that help to eradicate other parasites include HeartGuard Plus, Iverheart, Sentinel, Interceptor, Revolution, ProHeart 6, and filaribits. Please refer to the individual products labeling to learn more about what they prevent and how they are administered. Added protection to these other parasites is very helpful during a dog's first year of life when they are more susceptible. Can cats contract heartworms? Though not nearly as common as canine heartworm disease, cats can get heartworms from mosquitoes. This heartworm infection can be diagnosed with a blood test similar to the canine heartworm test. There is also a feline heartworm preventive that should be considered for cats that have regular mosquito exposure. Examples of these preventives include HeartGuard, Revolution, and others. That ends our discussion on heartworms and heartworm preventive. This program has introduced you to the many components of preventive health for dogs and cats. You can now use this knowledge to effectively teach your hospital's clients how to better care for their pets.